I'm Casey McManaman, Chair of the Bridge Board of Directors, and I thank each of you for signing up for today's event. The mission of the Bridge is to empower adults experiencing homelessness in Dallas with the tools to homeless recovery as they move into sustainable housing. Now, you might say that that is an aspirational statement, and you would be right. That is our commitment, to provide comprehensive, centralized, customized care in a safe, welcoming environment, delivering a tailored path to recovery from homelessness and ultimately into appropriate housing, one guest at a time. The Bridge, not unlike many other nonprofits, is facing several challenges derived from the coronavirus, including increased expenses on our campus, the impact of the economic decline and resulting unemployment, and reduced charitable giving. I thank each of you for your interest and support of the organization, and the Bridge looks forward to working with each of you in our collective pursuit of ending homelessness. I'm honored now to introduce my colleague and friend, Dr. David Woody, President and CEO of the Bridge, who will lead us through today's discussion. Dr. Woody.
Thank you, Casey. It's good to have everyone here this afternoon, and I appreciate, I'm humbled that you would make the choice to join me, to be willing to listen. Listening is a big issue around the country right now. Folks believe that that will help us transition and facilitate change. So again, I appreciate your willingness to listen this afternoon. And I really appreciate the support of Allen Media in terms of offering me this opportunity to share a little bit about the Bridge, our response to COVID-19, racism, and homelessness. Where do we go next? Casey mentioned our mission: empowering adults experiencing homelessness in Dallas with the tools to homeless recovery as they move into sustainable housing. The Bridge has been at its location here in downtown Dallas since 2008. We just celebrated our 12th year anniversary. And the mission statement that has been repeated here is just a refinement of who we are and our particular importance in this community. The Bridge Homeless Recovery Center is more than a shelter. We are, again, about empowering our guests. We are keenly focused on crafting with our guests an exit strategy from homelessness. We have many shelter partners in this community, and many who offer our guests a great opportunity in terms of night, to not be on the street, wrapped up in a blanket over their head and trying to protect themselves from the elements, that they would join our homeless response system in terms of offering our guests shelter. But we are special in that, number one, we are about recovery. But number two is we see nearly 80% of the homeless population here in Dallas because of our unique model focused on recovery. We are keenly focused on some of the stats that you will see coming up on the next slide, which reflect for you just a little bit of the focus, the general focus that we would have on various components of what it is to recover from homelessness. We, on our campus, have major service providers in our community who meet the needs of homeless individuals. Parkland Hospital has a clinic on our campus, physical health needs. MetroCare Services has a clinic on our campus to meet folks' behavioral health, mental health, and substance abuse needs. We have a relationship with legal aid to help folks with tickets and warrants, things that would preclude them from acquiring housing. We work closely with the Veterans Administration. They have an office here. We see a number of vets who may feel some kind of way about using VA resources, to have someone who could process that with them and facilitate their getting to the VA hospital here in Dallas is incredible on our campus right here. We serve 3 meals a day. We have showering and restroom facilities. We offer hygiene kits. Most are not walking around with a towel and a toothbrush and perhaps a comb. To give that to them, to allow them to get that need met is incredible. We have a library on our campus. We have a barber shop on our campus, again, taking care of basic needs. 12 to 15% of the homeless population has a companion animal. We have a kennel on our campus. We don't have any dogs here, ma'am. Do we have any slides? Unfortunately, the dogs is one of the most incredible parts of what it is that we offer here. Most shelters don't. And what does that mean? If there's no kennel on the campus, folks who need to be out of the elements, off the concrete, they don't have a place to come because they won't abandon their companion animal. So we offer that. So again, we are about what my resource development officer, Nick Coletti, describes. We have a suite of services that we believe help to facilitate our guests' recovery from homelessness. And number 2, we are about trying to facilitate our guests acquiring a home of their own in our community. And in our community, there is not enough affordable or permanent supportive housing. And so we are incredible advocates for increasing that resource in our community. You will begin to see some slides about who it is that we serve: moms, dads, sisters, brothers. It only takes that one thing for many of us, too many of us, leaving paycheck to paycheck at this moment, to fall into homelessness. And in fact, right now, COVID-19 could be that one thing that pushes individuals into homelessness. The joblessness numbers. I am afraid of what's going to happen in 6 to 8 weeks when evictions start to come to fruition. All of those things will conspire to create the need for all the resources that we have here. You see some percentages in front of you in terms of males and females. Generally, those percentages are what are seen across the homeless community across the United States. I think the next slide talks about issues of the ages, to see folks between 25 and 34, homeless. Individuals over 55, 26%. If you come to our campus, many are alarmed. They're concerned when they see the number of individuals on our campus in a wheelchair, on a walker, on a stick, as my family used to say. Incredible. And so we have to have the compassion. We have to have the skills to meet the needs of a very large swath of the homeless community. Again, we serve single adults and males 18 and over. The next slide talks about the racial makeup of our population. Here in Dallas, over 60% of the homeless population is Black, African American. That is a concern. We have to be prepared to both assess that kind of experience, individual guests by individual guests, and we need to take what we know about those experiences, those individual experiences, and lift them up to our community, because obviously something is wrong when we have such a great disproportionate representation of the African American experience in homelessness in Dallas, Texas. COVID-19. Most of us have been impacted by the issue of COVID-19. Early in March here in Dallas, our local county health authority was pulling folks together to begin to educate us on what COVID-19 is. What is it? Why should we be concerned about it? Why do we need to get prepared to deal with it? Mid-March, there is a shelter-in-place order that's put in place. And all of a sudden, all of us have to be prepared to implement evidence-based strategies to protect the vulnerable homeless population here in Dallas. What that meant for the bridge is that we needed to implement spread reduction and social distancing expectations now with a shelter-in-place order. And in fact, more importantly, how does a homeless person shelter in place? And so we had to reduce. We were seeing pre-mid-March, nearly 900 people a day on our campus. Obviously with COVID-19, we couldn't continue to do that. We sleep at night, 310 individuals on our campus. With social distancing, we could no longer do that. And so, yes, we had to begin to say that when anybody enters the campus, they're going to have their temperature taken. They're going to be offered hand sanitizer. Our staff is wearing gloves. We are wearing masks. We are educating employees, because employees have to educate, have to communicate with our guests. Individuals who are having significant mental health or behavioral health issues, we have to be knowledgeable enough and use skills to ensure that panic, fear, feeling in crisis, that we are not creating that environment on our campus. And so we had to reduce our census during the day, reduce our census during the night. I'm concerned what's going to happen to folks who no longer can be on our campus. And so we crafted a partnership with other shelter providers and the City of Dallas Office of Homeless Solutions, who opened up K. Bailey Hutchinson Convention Center for offering shelter to the homeless over the last 4 months. Incredible blessing. And they are serving 350 to 400 individuals a night. And again, in the environment pro-COVID-19, we knew we had an issue because there weren't enough shelter beds in existence pre-COVID-19. So having to contract to meet social distancing, spread reduction, best practices, we knew we had an additional problem on our hands, so that the City of Dallas would come up, could step forward in this was incredible. A major issue for us is that we have remained COVID-19 free. I don't know how to answer the question. Again, yes, we're planful. Folks are implementing our expectations. Our guests have been incredibly responsive, reminding me, Dr. Woody, where's your mask? Incredible that they are educating me, helping me to grow more disciplined in this. For everybody, that has been a challenge, the discipline to take care of oneself, to protect others, and to come together in keeping our campus COVID-19 free. Incredible, miraculous. Another issue, though, is that what that has meant, and we have not had as many volunteers on our campus who help us so incredibly, keeping our library open, supporting our meal services, helping us relieve folks in particular parts of the campus at critical times. Karaoke once a month, bingo twice a month, supporting us with our kennel activities. All of these things that all of us had grown accustomed to, we've not been able to implement, and we miss those volunteers. And again, for us, that is a huge asset to us in terms of getting the message out about homelessness, how it is that folks can help in terms of their own personal treasures, their own personal skills. And so COVID-19 has dramatically impacted how it is we function as an organization over the last 4 months. Mr. McManaman mentioned the issue of fundraising, that we're all scrambling, nonprofits, with how do you connect with potential donors in such an environment? And so the fact that you are looking at me here today is awesome. We are trying this out. How do we push forward with this? Lastly, I would say this, that our skills as an organization at communication have had to grow. Not only are we growing in terms of our employee relationships, what are our fears about COVID-19? Okay, we were deemed an essential business, which means that employees needed to come to work. And we've been blessed with that folks would come to work. But we also have to educate folks. How do you protect yourself in our environment? What should you do when you leave our environment such that you're protecting your family? And when you come back to the campus, that we keep our campus COVID-19 free. Upon entree to the campus, getting your temperature taken, making sure you're washing the hands 2 times, happy birthday, hand sanitizer, where's your mask? Do you need gloves? Reminding one another about that. And ultimately, our guests are absorbing that. They are growing in their own personal skills in terms of protecting themselves. We continue to house people. And so they will take these skills, they will take this knowledge to a home of their own. And that will be even more awesome. Many of you have heard of Maslow's hierarchy. When I think about the bridge, we are about the last 2 layers of that pyramid, taking care of folks' basic needs. And again, this campus is about creating an atmosphere where folks can at least contemplate what their recovery experience should be like. We are taking care of folks' physiological needs. We have an incredible safety officer team managing our safety needs. We are helping folks with employment. We are helping folks identify benefits that they're eligible for. The fact that folks can get their health needs and mental health needs taken care of, that we are working with them to identify a home of their own. We are taking care of all of those things which tee up for individuals being successful in a home of their own. I love that model. I think it clearly shows what our area of focus is. And ultimately, in our mission statement talks about it. We want to empower folks to be successful. And if we can help them on their campus, we are going to launch them in terms of being successful in the community. Racism. Most of us were heavily impacted by the video, the 8 minutes and 36 seconds. The loss of Mr. George Floyd. That we as a community on this campus would have to think about the impact of that event with our guests. Many of our guests have had challenging, for lack of a better word, experiences with law enforcement. How it is that we are prepared to have impactful conversations, dialogue, to talk with our guests about trauma. Trauma in their lives, trauma which may have impacted them to such a degree that they were unable to manage work, family relationships, taking care of oneself. Their mental health may have been damaged. Too much, we may have been indifferent to that. And so now we are struck by the video. We have to be prepared to have meaningful conversations with our guests about the impact of trauma, about the impact of bad experiences with others in other systems, and how do they put those experiences in a manageable place such that they can recover from homelessness. This campus is about offering access. When we talk about systemic racism, often we're talking about, for the homeless, an inability to access critical issues in their life. Physical health care, mental health needs, employment, making a livable wage, housing options. Folks come across our threshold and they don't believe that they have access to those opportunities. And so we have to assess, talk with folks, communicate with folks about their uniqueness. What about issues that undermine you, made you feel terrible? That they would feel listened is an incredible experience. That is a critical component of facilitating recovery. We have to be about a beacon of hope. How is it that we can attract to us folks who are struggling in this environment? How do we attract them to us? Recognize the significance of racism with all kinds of other dynamics, and ensure that folks are understanding through assessment, and that they are involved in what we describe on our campus as crafting a care and housing plan. What is your exit strategy from homelessness? And doing that in a way at this time which is responsive to issues of racism and discrimination, folks understanding it, and how is it they manage it such that they can move forward. We have much to do. We have still much to understand. We have, for example, continued to house individuals in the COVID-19 environment at a higher rate than our goal at this point. But that's a reflection of our staff being active in identifying landlords in areas of the community which will be responsive to the needs of our guests and the support that the Bridge can offer them in supporting the housing of our guests. In an environment where racism is a huge concern in housing in this community, well documented. We don't need to argue about it. Right now, we need to have change happen. Finally, our mission, again, to empower. I talk too regularly, my staff probably would say, about the notion of critical thinking. Looking at issues, looking at concepts. What do those things mean for you? How is what they mean for you, how does that impact your life? How does that impact your capacity to help a homeless guest? Empowerment. Empowerment. Our goal, again, is, and we're talking about this from the get-go, as soon as folks walk into Building 6 on our campus, what is your housing goal? For some, that may mean that we would divert them. They don't need to come to the campus. Can we make a call to your family? How is it that we can connect you with resources such that you don't have to be homeless? But for those that come on our campus, we want to assist you through our 2 care management teams with managing this strategy, this exit strategy from homelessness. Right from the top, Mr. McManaman described that we need your help. Asking questions. We are challenging folks to really understand homelessness. Ask questions. COVID-19 starts running down. One of the greatest ways to understand homelessness is to come to our campus. See who we are in terms of a facility, but experience our staff and how it is that we connect with our guests. Understand how it is that racism may be perpetuated in our community through policies and practices. Advocate for the homeless. We need more physical health opportunities. We need more mental health opportunities for the homeless that are affordable throughout our community. Housing. We know that there is not in this community enough affordable housing. And that is a combination of policies and practices that preclude such from being available. How can you understand that and advocate for more affordable and permanent supportive housing? Donating your treasure, time, money, items around your home. We need your support. Our guests benefit from what it is that you would bring to our organization. Check out our website. Follow us on social media. I'm an old schooler. But I've got great people helping me to get the message out. We need to be nimble. We need to be effective. So thank you for listening. I think there's going to be time for questions and answers. What can I say? Hopefully, I would do this, inspire you to think carefully about homelessness, to think carefully about issues of racism, and most importantly, to think about how you can have an impact on your community.
Dr. Woody, thank you so much. We do have some questions. So if you have a question, if you've been participating in this webinar and listening to Dr. Woody talk about the imperfect storm of racism and COVID and homelessness, please add your question to the Q&A section. I see we already have one question, and it's a great one, Dr. Woody. Okay. What are the long-term opportunities for Dallas related to homelessness? So specifically to Dallas, what are those opportunities?
There has been, for example, money that our citizens voted to set aside to improve the availability of housing in this community. It is approaching 3 years ago now that the citizens voted 25 million. That's just a drop in the bucket, but 25 million. That money has not been put to use yet. We need to figure this out. I would love to partner, that the bridge would partner with a developer who would say, I'm willing to renovate, I'm willing to build some affordable housing, but I'm also wanting to make such available in a way that would have support services available. We don't just put folks in housing. We also expect that our care managers are doing what we describe as housing follow-up, 6 to 9 months, where they're helping guests craft their social network. And so housing, I want to acquire more guests on the campus who would otherwise be sleeping on the campus, sleeping on the concrete, that they would come onto our campus, engage in a recovery process, that we would tee up their readiness to be in a home of their own, and then get them out there. But right now, I don't have that flow because there is not enough affordable housing to make that happen. Housing. Jennifer?
So that's a great link into the next question. One of our guests on the webinar says, how would the Trump administration's proposal to allow agencies and communities to conceal ongoing segregation and housing discrimination impact the Bridges housing placement initiatives?
First of all, the environment is screaming that there needs to be change. That we should not accept racism and discrimination. Our approach to crafting relationships with landlords is about broadening opportunities, not only for the guests, but also for the landlord. We have learned there are an incredible number of landlords who want to support the community through giving individuals who have had a hard time a second chance, who want to support by making housing available. And so we have been culling neighborhoods, looking for landlords and units that would allow our guests to transition from our organization, to allow us to go backward now. That policy would be allowed to come to fruition that would continue separation of folks, not only in terms of color, but also in terms of financial resources, financial status, that we would not continue this moment of coming together. That's just unacceptable. And so we are advocates. We are going to push back, and we're going to find landlords who will help us implement that pushback.
It's a good question. We also have a comment from Mr. Nugent, not a question, but thank you for the work you do and this presentation. I have another question. This is from Janet, and she says, and I think you just answered this, but what policies are needing change, and why do you constantly blame racism? And I think that's a great question to answer.
I wish that our guests had opportunities to find affordable housing throughout the city of Dallas. But that's not the way it is. And when you're needing $1,300, $1,500 a month, the average for housing, any of us, that puts our guests at a disadvantage, okay? Which leaves their options too often in South Dallas. We are looking for opportunities to house people across the community. And what I would say is this: racism is a component. I hope folks didn't hear that I was saying it's all racism. I don't think it is. But it's certainly, over time, a long period of time, has disproportionately affected people of color. racism affects David Woody. It does. People won't believe it. We don't have enough time to tell stories, but it does. I have had the support and encouragement to put some of these incidents, which have piled up, accumulated over time, in a manageable place such that I have this incredibly humbling position. And so when I walk onto our campus, which has a high percentage of African American or Black homeless individuals, they are looking for how did you do it? How did you put that in a manageable place? Modeling how to not be overwhelmed by it. I hope folks aren't hearing that it's all racism. It's not all racism. But we're at a moment right now where we're able to put things under the microscope and see how significant racism may be for a lot of the outcomes that we see.
That's a great answer to a good question. And I know that I'm going to keep going through questions, so please keep sharing them. And I know that we won't have time to answer them all because we have so many participants on the call, but we'll get to what we can, and what we can't, of course, we'll answer in a follow-up email to this. And then maybe share some resources too.
Okay.
So tell us your thoughts on, from Donna, tell us your thoughts on shelter resistant.
Cool. We have to acquire a lot of support from other agencies in our community who are doing outreach. Yes, it is amazing that individuals would be in such a state internally that sleeping on the concrete is okay. And there are typically a number of reasons for that. That's why folks coming onto our campus, we are trying to do a complete assessment. Okay, how is it that someone got there? Okay. Yes, we are concerned about encampments around the city of Dallas. Folks who would choose to sleep in wooded areas or underneath an overpass or underneath a bridge, okay? Most of us would not want to do that. That some of our guests are okay with that is something that through engagements, consistent, regular engagements with folks, crafting relationships with these folks, and talking about all of the resources that we would have here to allow folks to take advantage of crafting a better life. We often have to go and work with our partners on those regular, ongoing engagements, which hopefully allow folks that they have more options. For many, the challenges, and as a social worker, one of the basic principles of my profession, my discipline, is self-determination, which is rough. I have difficult time when I walk off of our campus and someone is sleeping on the concrete, and I call somebody on our staff and say, hey, there's a person out there who needs to be engaged. Who's going to do it? And hopefully encourage them to come on the inside. Behavioral health issues are so significant. We can't minimize the significance of that. And through an assessment, we can help folks figure that out, okay? But again, for many folks, and again, the other thing I often say, why is it that someone should trust David Woody who is trying to engage them on the concrete? They may see me as the problem person that they really had an issue with so long ago that they don't want to take advantage of these resources. And so David Woody has to figure out through skills and engagement and not being afraid of how it is that I can begin to craft a relationship with folks that would allow them to see the bridge as an option. And that's often what we're doing with our service providers who come alongside us in doing outreach, okay? Talking with them about what we offer, how we offer it, to whom we offer it, how often we offer it. If they had a bad experience, come back, meet with us, visit with us. The bridge isn't what it was 2 years ago. Persistence, not just thinking it's okay for folks to sleep in an encampment, in a tent. Got to hold the focus, which is reduce homelessness, person by person.
Thinking
Jennifer?
about reducing homelessness, we have a question from William about tiny homes. Are tiny homes part of that solution?
Yes, they could be. I have traveled to Seattle, Washington, where they have city parcels of land on which they have tiny homes. A great option for folks other than sleeping on the concrete or in a shelter, for that matter. Austin, outside of Austin, has this incredible tiny home community. And again, it's crafting community for folks, which is incredible. That's affordable. It's their own. To go, when I went to Seattle, and to talk with folks in those experiences and how great they felt that they had a home of their own in the community that was reasonable, they could afford. Who doesn't want that? And so that we're offering that. How awesome would it be that we could offer tiny home communities here, as well as regular apartments, or even a home for some folks? Yes, we need to expand the continuum of housing options, and tiny homes is a great one.
Thinking about that, going back to that $25 million that the city of Dallas voted on, Kirsten is asking, why hasn't that been deployed?
I know that the city has put forward some awesome opportunities. Okay. Submit the desire to get involved in this kind of work and what your plan would be. I know that the city has also reviewed some of those things and tried to tee up some options. One of the major challenges has been, how do we, among citizens, kind of come together to see reducing homelessness as a critical issue? Okay? There are many folks things Jennifer, can you see me?
I can see you now.
You can see me?
Yes, I can. Well, you were doing great.
Okay. Are we good? We still good? Can I
It's
pick
okay.
up?
Yeah, I think you should pick up that question, and then we've got time to ask maybe one or two more, and then we can let folks go.
Okay, great. And I think before I froze. Um, I was talking about the notion of kind of what's happened. Why hasn't those dollars been deployed? And I think that I know that there's been tremendous advocacy from the city in terms of how it is that we can begin to deploy those resources. But the issue is one of educating our citizens about the significance of homelessness and issues of fear. What if I have a developer who wants to put in affordable housing in a neighborhood that there may be individuals who are afraid of what that would do? Property values, crime, all of those kinds of things. And so what I would say is that we have to see this as a movement. Well, how is it that we can strengthen the messaging about the needs of the homeless, the needs for more affordable housing, and how is it that we can make such palatable in any neighborhood? I know I'm part of neighborhood associations, the Cedars, Farmers Market, Central Business District, going and talking to people about homelessness, what the bridge is doing, how we partner with folks, the significance of us being in this neighborhood and property values going through the roof, crime coming down. We have not communicated well enough about that. And so, yes, that's what it is. And so people will ask me to come and speak. I love that. Invite me so I can talk about our experience, how it is that I can offer and the bridge can offer a community support in addressing issues in your community. How is it that we craft a manageable, affordable housing strategy for your neighborhood? Talking, dialogue, reducing fear through those options. That's what I want to be about. That's why I've got lots of friends who would love to help. So while there may be other things, we are challenged with, let's put reasonable projects up for folks to consider in communities that will address this issue.
I've got another one. We'll kind of maybe make this our second to last. What has been the direct impact on the number of guests you can serve with the health and safety restrictions of COVID? And I'd like to link that to another question, which is, what can I do to help right now? And I know that the bridge has had to cancel some of its fundraising events. And I know that the demand is greater than it's ever been. So if you'll talk about what that direct impact on the number of guests you've been able to serve with the health and safety restrictions of COVID, I think it'll take us to what people can do to help.
Okay. We have, because of the spread reduction and social distancing expectations, that's reduced the number of individuals that we can serve on our campus at any one time. Okay. Again, pre-COVID-19, we're approaching, unfortunately, nearly 900 people coming onto our campus a day for day shelter services, all of the suite of services that I described earlier. Okay. We have had to reduce that because of a fear of the spread of COVID-19. Okay. That has meant that we have had to work with our partners and the city of Dallas on how do we, in the meantime, get folks' needs taken care of, rather than they be left out on the street, not taken care of. We are in the midst right now of a transition process from the convention center to repopulating the shelters. Okay, this plan had been established prior to the recent surge. I'm hopeful over the last 2 days that we are beginning to plateau a bit, and because we are in the midst over the next 3 to 4 weeks of trying to repopulate the shelter. Okay, having the staff ready, care management ready. And so what we have been doing is trying to wrap up our needs for hand sanitizer, gloves, masks, all of that. We have to be ready to go as more folks come back out to the campus, okay? And we are engaging more intensively on trying to help folks. We have just begun a rapid rehousing program. We want to get folks back out into a home of their own, which has meant really ratcheting up amid COVID-19 our relationships with landlords. Okay, and so yes, Jennifer, you mentioned that we had to cancel. We had a golf tournament that was supposed to have happened last month that we pushed to next month, that we pushed to next April now. That was a significant fundraiser. We had another great, awesome opportunity as a result of Taste of the South and working with our legislators in Washington. And
Looks like we may have lost our connection. So we'll just give Dr. Woody a minute to get back on. If you haven't gone to the Bridge website and made a donation and you're in a position where you can help, as Dr. Woody said, there were some wonderful fundraising events that were set for this spring and fall, and they're on hold because of the COVID-19 pandemic. Please go to the Bridge.
Back.
Oh, you're back. Great.
Aren't we all learning? Isn't this incredible? So, yes, we need support. Obviously, to have general operating dollars would be incredible because, as you can imagine, what's happened the last 4 months, we hadn't budgeted for this. And in fact, we're 2 months away from the end of our fiscal year. So David Woody is nervous right now, okay? So to have that support from folks to reduce homelessness, to help us in acquiring hand sanitizer, masks, gloves, all of those kinds of basic needs is really great. We have had to ratchet up our cleaning, right? From maybe once or twice a day to now we're regularly wiping down door handles and all those kinds of things. Again, to maintain the fact that we have not seen COVID-19 positive tests here on the campus, which is incredible. So yes, your capacity to support us to sustain what we've been able to do so far would be incredible.
We have lots
Jennifer,
of.
Apologize. We keep going out. We're going to get through this.
We can do it. Well, we have so many great questions, and it's 1 minute from 2 o'clock. So I want to say thank you, Dr. Woody, and thank you for sharing everything. One of our questions put it best. He said, from Scott, love your passion for the homeless, Dr. Woody.
Right.
Those of us who know you know it's your life's work, and this is a great start. And so I think he's put it very, very well. So thank you so much. And thank you, Casey, for introducing Dr. Woody. And please, please go and support the Bridge. And we'll be sharing. There were so many questions that Dr. Woody wasn't able to get to today, but good news. We have an opportunity to answer those questions and to share resources, and we'll do that. Really be thoughtful. I know we want to be thoughtful and intentional about how we answer those questions. Yes. And so we'll be doing that and sharing this recording. So thank you so much.
Thank you.